Hey there, friends. I'm Dr. Evelyn Ross, and welcome to Men's Health IQ, your go-to spot for honest, heartfelt conversations about men's health. Today, we're opening up about a topic that's on so many minds but often stays in the shadows: penile lengthening. I get it. This can feel deeply personal and even a bit raw to talk about, but that's exactly why we're here, like sharing secrets with a close buddy who's got your back. This episode draws from the insightful work of Dr. Reena Malik, a top urologist in this field. Hang in with me to the very end, because the most vital insights, warnings, and steps come later. You don't want to skip them, and if something here hits home, drop a comment below with your thoughts or questions. It builds our community and helps me tailor future chats. Let's start with some basics about what's considered normal when it comes to penile length. I want to share this with you in a simple way because it's something a lot of guys wonder about. Researchers looked at data from over 15,000 men and found that the average erect length is about 5.16 inches, or roughly 13 centimeters. When it's flaccid, the average is around 3.61 inches, or about 9 centimeters, and the average girth when erect is 4.59 inches. Now, what's normal can vary, and studies show that a typical range for erect length is between 3.9 and 6.5 inches. That range covers what's healthy for most men. There's also a condition called micropenis, which is when the erect length is less than 2.8 inches. This is very rare, affecting only about 0.14% of men, and it can be caused by hormonal issues, birth conditions, or past surgeries. So if your size falls within that normal range, you're doing just fine. But I know feelings can sometimes overshadow those numbers, and that's okay to acknowledge. That brings us to something called small penis anxiety. This is when a man feels distressed because he thinks his penis isn't long enough, even if it's actually a normal size. It's a type of body dysmorphic disorder, which means it's more about how you perceive yourself than the reality. Doctors define it as spending more than an hour a day worrying about this, and for some, it can really disrupt their daily life, lead to depression, or even worse thoughts. I've seen studies that show most men with this anxiety have a normal-sized penis, but still feel a deep sense of suffering. Culture can play a big role too, maybe in some Latino communities where machismo is strong, or in Asian households where family jokes might add pressure. You might also see online forums pushing the idea that bigger is always better, but research tells us that satisfaction in relationships comes more from emotional connection than size. Have you ever felt that pressure from culture or media? I'd love to hear your thoughts. Comment below. Now, let's clear up some common myths. You might hear about pills or pumps promising overnight growth, but those don't work for permanent gains. They're just not backed by science. Another myth is that your race determines your size, but the differences are tiny, less than half an inch. Some people even think no size relates to penis size, and while a 2023 study suggested a weak link to girth, it's not something to count on. Then there's jelqing, a stretching technique that sounds tempting, but it can cause injury and doesn't have proof it works. And pumps, they might give a temporary boost, but it doesn't last. What's a myth you've come across or believed? Share it below. I'm curious. Lifestyle changes can make a difference in how you feel and look. For example, if you carry extra weight, it can hide some of your length, and losing 35 pounds might reveal about an inch more. Another simple exercise is Kegels. Try squeezing the muscles you'd use to stop urinating for 5 seconds, then release, and do that 10 times, 3 times a day. It can strengthen your erections. Eating foods like oysters or nuts, which are rich in zinc, can support your hormones, and turkey has L-arginine, which improves blood flow. Cardio exercise like walking or jogging boosts your vascular health and can lower the risk of erectile dysfunction. Managing stress, avoiding smoking, and drinking in moderation are also important. You could start by walking 30 minutes a day and using a mindfulness app to ease anxiety. Little steps can add up. Let me share some stories to make this feel real. Take Alex, a 32-year-old accountant who was so focused on his 5-inch length that he avoided dating for years. He blamed media pressure, but therapy helped him let go of that worry. Then there's Miguel, a 45-year-old Latino teacher who felt ashamed at 4.8 inches because of machismo in his culture. Turns out his wife valued his kindness more. James, a 28-year-old athlete, got caught up in locker room talk and tried risky online remedies, only to end up with irritation. And Raj, a 38-year-old engineer from an Asian background, traced his obsession to family teasing. Counseling gave him back his confidence. These stories show how opening up can heal. Do you have a story to share? Comment below if you're comfortable. Looking back, people have tried to change penile size for centuries. Ancient Egyptians used weights to stretch it, and in the 19th century, some shady doctors sold vacuum devices that ended up hurting people. In the 1960s, silicone injections caused lumps called granulomas, and in the 1990s, a celebrity had deformities from fillers. In India, Ayurvedic herbs were used, but they mostly worked like a placebo. After World War II, surgeries from war injuries paved the way for modern techniques, though ethics are much stricter now. Question: what is the difference between small penis anxiety and micropenis? Small penis anxiety is when you feel upset about your size, even if it's normal, and it can affect your daily life. Micropenis is a medical condition where the erect length is less than 2.9 inches and might need treatment. Question: what are some tips for measuring at home? To measure at home, when erect, press lightly at the pubic bone and measure to the tip. You can also stretch it when flaccid and measure. That's a good estimate. Avoid doing it in a cold room or right after exercise. Question: how does porn impact perceptions of size? Porn often shows men with sizes averaging 7 to 9 inches, which can make average guys feel anxious, and studies suggest it increases anxiety by about 20% for regular viewers. Question: are there natural ways to boost size? There aren't any foods or exercises that directly increase length, but L-arginine from Turkey can improve blood flow, which helps erections. Jelqing, though, is risky and not proven. Question: how does age affect penile length? Your size stays stable after puberty, but after 40, you might lose about 0.5 centimeter to 1 centimeter per decade due to reduced elasticity. Question: can weight loss help with visible length? Yes, losing weight can help. For every 10 kilograms you lose, you might see about 1 centimeter more of your length because it uncovers the base. Now let's dive into the options that might help, starting with non-surgical treatments. The first and most important one is psychological counseling. There are tools like the Cosmetic Procedure Screening Questionnaire that can help you understand what's normal and work through anxious feelings. Studies show that 80% of men who try just counseling decide they don't need other treatments. It can be a game changer for letting go of those worries. Another option is penile extenders. These are devices you wear for 4 to 6 hours a day over several months, using gentle traction to stretch the penis. Research shows they can add about 1.8 centimeters to flaccid length and 1.7 centimeters when erect. Newer studies, like those from 2023 to 2025, including one on RestoreX for a condition called Peyronie's, confirm they work, with a 2024 review backing this up. You might get minor bruising, but it's generally safe if you stick with it. Then there are vacuum erection devices, which can help with erections but don't increase length at all. And injections. They've been tried with different substances, but about 30% of men experience complications like lumps or worse, so I really don't recommend them. Speaking of supporting your body's natural renewal, especially as we talk about health and vitality, have you ever noticed that as you get older or deal with stress, your body doesn't bounce back like it used to? Maybe you feel tired more easily or notice slower recovery. That's a common concern, and it's something I hear a lot about. That's where STEM Active comes in, a premium stem cell supplement from Healthy Home designed to naturally boost the stem cells circulating in your body. Research shows that an ingredient called Madagascan aloe macroclada can increase those stem cells by 40 to 60%, and Tibetan sea buckthorn can add another 33%, helping with repair and overall wellness. It also includes Klamath algae, L-theanine for focus, and coffee bean antioxidants, all vegan, natural, and free of gluten, dairy, and nuts. You can take it as capsules or packets every day. If this sounds like the support you've been looking for, scan the QR code on screen or click the link in the description right now to learn more. Now, let's get back to those evidence-based lengthening options. When it comes to surgery, I want to be upfront with you, friends. Please approach this with caution. One common procedure is called a suspensory ligament release, where they cut a ligament that attaches the penis to the pubic bone. This can add 1 to 2 centimeters to the flaccid length, but the erect length doesn't change much, and there are risks like instability during erections. Other techniques use flaps, grafts, or even cartilage, but they often lead to low satisfaction, and complications happen in 15 to 25% of cases. A 2024 review calls these experimental and high risk, so they're not recommended unless it's part of a clinical trial. Those trials have oversight from an institutional review board to ensure safety and ethics with real data collected. For example, a study from Johns Hopkins found that this surgery gave 2.5 centimeters of gain but came with a 10% risk of erectile dysfunction. I've heard from patients like Tom, a 50-year-old who had reconstruction after cancer and found it helpful but emotionally tough, and a young veteran who combined therapy with minimal surgery and said it changed his life. There's a myth that surgery guarantees a big increase, but it's usually just 1 to 2 centimeters at most, with risks involved. You could try yoga for pelvic health or use an app like Headspace for your mind to support this journey. Question: what are the long-term effects of using a vacuum device? They help with erectile dysfunction maintenance, but don't add length, and overuse can harm tissue. Question: why are injections considered dangerous? Injections can cause the filler to move, leading to asymmetry or problems that need removal years later. Question: what is the best age to consider these options? It's best to start considering options after 25, when growth stops, but focus on mental health first. So friends, the truth is that most of us fall within a normal range, and the biggest changes often start with how we feel inside. Penile extenders can offer a modest increase with dedication, but surgery is risky unless it's in a controlled trial. I encourage you to reach out to trusted professionals like urologists or psychologists for guidance. Please avoid quick fixes from abroad. They can lead to serious problems. If you're struggling with this, talking to someone can really help. Vulnerability is a strength. Thanks for this open chat. If helpful, subscribe to Men's Health IQ for more. Share with loved ones. You're worth it. Take care.